Melissa here from Embodied Pilates. Today I'm going to take you through some diaphragmatic breath work. So get ready, get a comfortable mat, perhaps some props for your head, and come to lie down in hook lying position. So hook lying, our knees are bent, our feet are flat, head elevated comfortably, and take a moment or two and notice your breath at the beginning of this practice. So perhaps taking 3 to 4 rounds of inhales and exhales, you're going to notice without judgment how your breath is feeling today. All right, we're going to revisit that assessment at the end of our series. And now we'll begin with a focus on air in and air out. You can rest your hands on your ribs as you observe air coming into the body on your inhale, air out of the body on the exhale. You're going to follow in your mind's eye your air in on the inhale and air out on the exhale. Don't worry if my cueing doesn't match the rhythm of your breath. Just do your best to follow the visualizations, to follow those verbal cues, observing air in on the inhale, air out on the exhale. See if you can take a few more of these breaths through the nose. So in and out through the nose, mouth gently closed, tongue resting on the roof of the mouth. And then we're going to bring our attention to our lungs. So inside of those ribs, whenever we take air in, the lungs fill up and expand. And when we exhale and air comes out, those lungs deflate and contract. So inhale, lungs expand, inflating. And exhale, lungs contract, deflating. See if you can follow the rhythm of your lungs for a few breaths, thinking inflate and deflate. We bring our attention next to the diaphragm. And as air comes into the body, the diaphragm moves down to expand that thoracic cavity. We can tap the edges of our diaphragm, starting from the bottom of our breastbone and following along the angle of the ribs, all the way to the low back, if that's comfortable for you to palpate. And so touching the sides or the edges of our diaphragm can give us more connection, more sensory input to that muscle. And as you inhale, that dome-like muscle goes down And as you exhale, that dome-like muscle goes up. So inhale, that diaphragm moves down towards the base of the pelvis. And exhale, that diaphragm moves up towards the head. See if you can picture diaphragm moving down as you inhale, diaphragm moving up as you exhale. So we can picture how that diaphragm divides our thoracic cavity, where our lungs live, and our abdominal cavity, where our abdominal organs live, of which there are many. And so diaphragm is the division between those two cavities. And when that diaphragm moves downward on inhalation, it presses on the top of the abdominal cavity. And that press down on the top of the abdominal cavity creates a response in our abdominal organs, and they begin to move slightly out the front of the body. So rest your hands on your abdominal cavity. And as you inhale, you might continue to feel the pressure of the diaphragm on the top of that abdominal cavity. But you'll also feel how those abdominal organs get gently pressed out to the front of your body. And that's often why we'll say, inhale, belly rises, and exhale, belly falls. Rising in this case meaning towards the ceiling, falling meaning towards the floor, but really that inhalation matches the organs moving more towards the front of the body, the abdominal organs. And then the exhale, those abdominal organs moving more towards the back of the body. So without effort, continuing with that nasal breathing, see if you can gently sense your abdominal organs moving to the front of the body on inhalation, and organs moving more towards the back of the body on exhalation. If you wanted to continuously reference the front of the body, you would feel those abdominal organs moving to the front of the body on inhalation, moving away from the front of the body on exhalation. So the last feature we're going to look at in today's breathing tutorial is our abdominal muscles. So because the organs are essentially expanding and contracting our abdominal wall, it also means that our abdominal muscles are changing length. So when we inhale, those abdominal muscles lengthen, and when we exhale, those abdominal muscles shorten. So just through the nature of inhalation and exhalation, the abdominals are being functionally conditioned. So when you inhale, you can think to yourself, abdominals lengthening. And when you exhale, you can think to yourself, abdominal muscles shortening. Inhale, abdominal muscles lengthening. Exhale, abdominal muscles shortening. And it's important that we allow for these motions as opposed to forcefully or effortfully creating movement. So we're more or less letting it happen and observing our rhythms in the body, lungs, diaphragm, abdominal cavity, and abdominal muscles. So there's this gentle domino effect. I'll try to cue all four. When we inhale, air in, lungs expand, diaphragm down, pressure on top of abdominal cavity, abdominals come lengthened. Exhale, air out of lungs, diaphragm up, pressure comes off abdominal cavity, and abdominal organs drop away from front of body. So that inhalation will start at the diaphragm, down, pressing on top of abdominal cavity, and abdominal muscles lengthen so that belly can rise. And exhale, diaphragm up, no more pressure on top of abdominal cavity, so the organs can drop away from the wall and the abdominal muscles shorten. It's a bit of a mouthful to cue all of those concepts together. So we'll end observing diaphragm and then belly. So inhale, diaphragm moves down. Exhale, diaphragm up. Inhale, diaphragm down. Exhale, diaphragm up. Inhale, diaphragm down. Exhale, diaphragm up. Inhale, abdominal organs to the front of the body. Exhale, abdominal organs drop away from the front of the body, essentially towards the back. So inhale, abdominal organs move to the front of the body, belly rises. Exhale, abdominal organs drop away from the front of the body, belly falls. Inhale, belly rises. Exhale, belly falls. Inhale, abdominal muscles lengthen. Exhale, abdominal muscles shorten. Inhale, abdominal muscles lengthen. Exhale, abdominal muscles shorten. Inhale, abdominal muscles lengthen. Exhale, abdominal muscles shorten. Go back to that nasal breathing from the very beginning, where you're mostly watching air in and air out. We'll do this in silence for a few repetitions. Slowly bring yourself to sit, or you can stay lying down if you prefer. And just appreciate that the quality, the connection to your breath perhaps change from the start to the end